Hey there. Today's episode, one of our sponsors and a pretty interesting group, which we're going to be doing a 3-part series on, is the team at PRISM. And I want you to take a look at this. Go to getprismrx.com. Once again, that's getprismrx.com. I'd like to welcome the founder and creator of this amazing system, Mary Kucek, who is a new friend and somebody that I really look up to. You're inspiring, Mary. I want to welcome you to TWIRx.
Thank you so much for having me.
All right. So, by the way, before we get into the 3-part series, I wanted to share something with our listeners that really inspired me this week in pharmacy. So let's jump right in. 1 second.
I've been traveling around rural America to ensure that women have access to contraception and women's health services. And here's a couple things that I've learned. 1, they don't. 2, domestic violence is on the rise again. 3, there's a lot of drug use going on right now, which I also think is driving up that domestic violence rate. So I wanted to make this video for women and also the abusers. So ladies, I am trying to reach different locations. I will be in rural California next in a couple of weeks. So see you out there. And to the abusers, I'm coming after you. Not like subtly, not just I'm getting her access to birth control and to control her life. I'm going to find a way to come after you too. That is a threat. Okay, bye.
Like I said, I have 4 daughters. I want them to be, they're powerful already in their own way, especially my youngest Lola, who is extremely Gen X-like. It's like she's born from the past to the future. And when I heard that, I'm like, we need more intelligent creators, technologists, physicians, pharmacists, nurses, to be coming to the defense of our public through technology and through standing up for, individual healthcare rights. And so I'm excited to be working with you guys. You guys are dynamic. Talk to us about this 3-part series and why you're so passionate about this.
Well, sorry to anybody if that offends anyone about me, my casual threat online, but no. Our 3-part series is really showcasing PRISM, which is an integrated electronic health record system designed for pharmacists. And this design has really culminated hundreds of different pharmacy professionals' opinions, feedback, and is backed by NIH-funded research. So we have been pedal to the metal, 365, trying to get this released, and we're starting with contraception as the first module or type of service to be provided within the EHR. Women have been forgotten in much of the healthcare space for a really long time, so we thought it was time that they actually came first on this one.
Give our listeners a quick overview of the system. Listeners, don't worry. The 3-part series is going to be starting soon. We'll also be putting this 3-part series out on several sites, blogs, obviously through LinkedIn and through social media. But Mary, talk to us about the platform overall, just as some highlights.
Yeah, so unlike traditional EHRs that were designed realistically for either physicians or only billing, PRISM kind of combines workflow automation with clinical guardrails and compliance tools to make it one seamless platform rather than you having to buy 5 or 6 different Frankenstein solutions and try to put them together. So it includes the clinical decision support based on your state laws and the CDC guidelines, and it automates your medical note, your SOAP note, and the documentation. And it's all HIPAA compliant, both on your side as well as the patient portal side, to make sure that you're staying in compliance the whole way through. It also allows for e-prescribing. So just like you get, the e-prescriptions through your PMS today, you would actually prescribe in our system, and then in your PMS, it would come through and you'd see your name as a prescriber, which is always a lot of fun for the first time for pharmacists to be able to see. So prescriptions are automated. You're not having to do duplicate data entry in multiple different systems that are all communicating individually. This is interoperability at its finest, built for pharmacists.
Love it. I love it. Hey, listeners, go to getprismrx.com. Once again, that's getprismrx.com. Mary, cannot wait to start this series, kick off the series. Thank you so much for doing this. Shout out to Devin as well. Dr. Bustin is there a husband-wife team, which that in of itself is so freaking cool. And we love this, and we can't wait to get started.
Thank you so much for having me.
All right. We'll see you soon.
See you soon.
This episode is sponsored by Independent Pharmacy Cooperative, widely known as IPC. Established in 1983, IPC is the nation's largest group purchasing organization owned by independent pharmacy. With a mission of maximizing the success of community pharmacists, IPC works to provide members with access to effective programs and services designed to enhance profitability for independent pharmacy. Read more about our mission by checking out our website at ipcrx.com. That's ipcrx.com.
Hey, and on This Week in Pharmacy, we're talking about lots of different things. Technology, of course, is always a leading subject that I love talking about. A shout out to IPC and their whole system around managing treatment plans for their patients that go far beyond the dispensing fee. I want to give a shout out to Clover Health once again, who has partnered with IPC, the Independent Pharmacy Cooperative. They made the news this week in pharmacy, and it says Clover Health, CLOV, their ticker symbol, launches a 2026 Medicare Advantage plan, and it goes through some of the new features of this plan, and they're unveiling its Medicare Advantage plan for 2026. It's going to be emphasizing its commitment to providing affordable and diverse PPO options for seniors and healthcare providers as the annual enrollment period begins. And the reason why we're mentioning Clover Health is because Clover Health has partnered with the Independent Pharmacy Cooperative, specifically with the iCare Plus plan system, which is so exciting. And I want you to know about that. I want our pharmacists, our pharmacy owners, our technicians to know that there are health plans out there that are very interested in the evolution of how insurance is going to be managed and the systems inside pharmacy to really not only track, but also make that information more accessible. I have a special guest today that's from the world of getting coverage in some way, life insurance, long-term care insurance, what that means. We're all living longer. We know that these is issues for many of your patients that are out there. So if you're listening and you've ever wondered, how do I dial into more services for my clients in the realm of long-term care insurance, and what does that mean for them in their livelihood and living longer? I want to invite my friend on to This Week in Pharmacy, Michael Banner. I'm so excited to have you on TWIRx.
Thank you so much for having me, Todd. I'm so excited to be here.
I'm not going to make you TWIRx, but if you wanted to TWIRx, you could. I can't do it. Like my butt's not jiggly enough to get any twerksing done, and I wouldn't imagine yours would be either.
Well, mine's jiggly enough, but at my age, you might have to dial 911 and have an ambulance come when I'm done twerking to take me to the hospital.
So any big plans for this weekend coming up?
You know, my weekends may sound boring, but they're the best in the world for a 67-year-old grandfather. My 3 children are all within minutes of me. My grandchildren, obviously, same thing. 2 of them are in Little League. 1 is in a travel league. So my weekends are having Mickey Mouse pancakes and watching baseball games and probably making videos for 62 Who Knew. But my weekends are a 67-year-old Poppy. That's what they call me, Poppy, because that's what my children called my father. They're a 67-year-old grandfather's dream.
Oh, I love it. I love family and what that means. And let's get back to the subject today, because I was really interested in meeting with you and understanding the element of long-term care insurance. I don't know much about it, but this is something that our independent community pharmacists and pharmacy owners should know more about and be able to reference options to their clients in their community, their patients, who know that, hey, I'm at a certain age in life, I'm going to be needing some kind of assistance or coverage or whatever. But talk to us a little bit about what is 62 Who Knew. And by the way, listeners, you can go to 62, the number 62, Who, W-H-O, New, K-N-E-W.com. It's going to be in the show notes too. But Michael, give us an overview of this.
Years ago, I started a television show on a small independent internet station. It was about a year and a half before COVID. And I won't say it was a fluke. I thought about it for a long time, but I kept reading these articles. It's not like I created any, new and original thing on my own, Todd. But, we're just living longer. I remember I'm old enough and I was blessed enough to have my grandparents in my life, and I remember them. And they, none of them were wealthy, but they did okay. But they planned on living to be their 70s. And then, of course, we had our parents who most certainly planned for the upper 70s or low 80s. And today, even though if you look up average lifespan, it's approximately 76 for a man, 78 or 79 for a woman. I don't know why it's like that. That's another episode that we can laugh about, why women live longer. But that is a true statement that's your average lifespan. But if you dig a little deeper, if you live to be 62 in this country, you have almost a 50-50 shot of making it to 90. Now, that's when you just think about that, that's 30 years. That's half the time you've been on this planet. And the truth is, unless you're in the top 2 to 5% of this country financially, and you don't have at least 4 or 5 million in the bank, let alone 10 million, 20 million, this could be a very rough 30 years. But if you plan it in your 40s and 50s, you can live just like your rich brother-in-law or your cousin, the high-paid attorney, because there are products out there that allow you to plan for this. And I knew nothing about long-term care insurance until about 21 years ago. Like most people who get into this industry, it's usually something personal, something from the heart. I had just an unbelievable relationship with my father. I wrote a book about him, A Gift from My Father. We were inseparable from the time I was little till the day he passed away. In the master bedroom, we had a home together, so he could be with his grandchildren with 2 master bedrooms. Down here in Florida, we call that the mother-in-law's suite. And like a lot of good sons and daughters, when we discussed who's going to take care of Dad, we lost Mom way too early to cancer. Dad lived much longer. I said, well, I'm the son and we're inseparable. I'm going to take care of Dad. And I can't tell you how many homes I've been in or people I've talked to where the daughter goes, no, I'm taking care of Mom and Dad, or the son says that. And it's such a warm thought. It really is. And then as Dad's health started to fail, around his 80th birthday, and I was just not happy that his health was failing, but so happy to be there for him. I quickly realized that being a caretaker to an 80-year-old man, with issues, medical issues, was a lot harder than I thought. The first time he, quite frankly, fell down in the shower. He was 6'1", 210 pounds. I'm a big guy, but I had trouble lifting. My son was there to help. The first time, quite frankly, that he had an accident in bed, and I helped him get to his chair, and I was cleaning up, and And he looked at me and pardon me if I tear up, but because it's 21 years ago, but I still remember this and him looking at me going, this is not what I wanted. When we talked about you taking care of me, I thought we were going to go to baseball games or go to watch, Joshua, that's his grandson, in karate tournaments. So Stacy, my daughter, his granddaughter, she was a competitive cheerleader. I didn't think you'd be, I'm just going to say it. If you have to bleep it out, that's fine. Wiping my ass at 3 a.m. This is not what I want at all. And so that next day we got help. So I could be his son in his last portion of life, not his nurse. And it kind of broke my heart. I said, are you sure? I don't mind doing this. Anyone, I know you don't mind, but I do.
Yeah. So
get help. So we ended up getting help, both skilled help and unskilled help. And we're going back 21 years, Todd. And Dad had fantastic insurance. Of course, he had Medicare. He had an incredible Medicare supplemental policy. Dad was also a highly decorated war hero from World War II, ex-POW. So the VA was giving him staggering benefits. And still, to keep my dad safe and healthy, we were spending about $7,000 a month out of pocket.
Jeez. To
keep him happy and healthy at home, which is the key, not in a facility. And one day, and we weren't millionaires, but we were in the mortgage business together and we did well. One day I said to one of the caretakers, I know I'm not naive. I mean, I'm 67 now, so I was 46 back then. What do people do that can't afford this? And she looked at me and went, Michael, your father would use his VA benefits and he would be in a Medicaid facility and you wouldn't like it at all. And I went, wow. And that's when I started learning about long-term care insurance, which is something our financial planner told me to buy him in his 50s, and I ignored him. What if he never needs it? I'm going to take care of him. Oh my God, all the excuses. But it changed my life, and it thrust me once we lost him, May 5th, 2005. I thrust myself from my then mortgage career into long-term care insurance as well. And I've helped a lot of people, and but it's very misunderstood, like so many things.
That's why I'm glad you're here, Michael, because the community pharmacies, which are now pressed, and now we're losing thousands of community pharmacies because of the shutdowns of Rite Aid is now gone. There's Walgreens that are closing. There's CVS's that are closing. Sometimes the only pharmacy left is our independent community pharmacy within their community. They've grown up in those communities. They've invested in those communities. So these are hubs. These are hubs of healthcare. People are coming there. They're coming to their independent community pharmacy not only for prescription medications, but they're coming for medication management reviews, durable medical equipment, so that they can walk around or use one of those high commode contraption things that fit on your and just over and over and over again. So what I want to shout out to our pharmacy owners right now is, do you have a suggestion for people who are coming into your store weekly, monthly? They see you, they're talking to you. They may be caring for a parent. They may be caring for a loved one at home. And my question to you, pharmacy owners and listeners, do you understand long-term care insurance? Do you understand how it works? Do you understand where it's best applied? So Michael, give our pharmacy owners who are listening right now, what is long-term care insurance and how does it work?
I'm glad to do that. And also just kudos to your independent pharmacy owners. I mean, again, our pharmacist growing up, it was almost part of the family. He knew my allergies. He knew my sister's allergies. We walked in and just kudos for being an independent pharmacy. Long-term care insurance is exactly what that is and what it says. It's the ability to have services, and this is the important part, come into your home to help take care of you. So many people think long-term care insurance is nursing home insurance. And that's what most people think, even professionals. And in reality, it's anti-nursing home insurance. Not that there's anything wrong with nursing homes, but every statistic, every medical study, every survey says people live longer at home. They don't want to go into the home.
Right.
They want to stay home. And unfortunately, the best example, sad as it may be, and I think that's why the world suddenly has long-term care insurance on the tip of their tongue, was COVID. Because the truth of the matter is, as the country went through COVID together, the senior citizens, which were the most demographic hit by losing them by death, the facilities in the country did what they thought that was right. They closed the doors. They didn't let anyone in because they didn't want COVID to come in from the outside. But really what they created, and hindsight is always 20/20. This is not a disrespectful comment. I'm not hurling, stones from a glass house. But what they did was they created a petri dish, and you had mom and dad and grandma and grandpa dying there, and they were saying goodbye to their children and grandchildren through a glass wall. And yet the senior citizens, the same age that were living at home and getting their care at home, they are still with us today. So COVID kind of proved that you don't want to go to the home. You want to live in your home. Now, of course, there's always an exception, safety. If you're not capable of being home, you have to be somewhere with care. Mm-hmm. But most people go to the home because that's what their Medicare is going to cover. That's what their limited insurance policy is going to cover. Long-term care insurance brings all those services to your house and allows you to live at home with your children, with your grandchildren, close to your children. Use your favorite pharmacy, use your favorite butcher in the supermarket, and all those things make you live longer. So in a nutshell, that's what long-term care insurance is. It's the ability to have all the services you need at home. But it goes a step further because people think, I'm going to replace my hip, which everybody does. I haven't yet, but I will, both of them probably. And I'm going to be home for a few weeks. I'll need long-term care. I can live with that for a few weeks. But in today's world, with scientific and medical breakthroughs, long-term care events can now be for months or years, and you're living a high quality of life while you're in this long-term care event. And if you're going to spend your money, your hard-earned savings, you're going to be broke very quick, even if you're wealthy, let alone if you're not wealthy. So long-term care insurance, like all insurance, is to protect your wealth or whatever you have. It's to insure against risk.
Yeah, so I want to once again give a shout out to Happier at Home, which is a Debbie Marcello has committed her entire career as a nurse who came from helping people live longer and be happier at their homes. Now she formed a franchise that bolts on to a community pharmacy so that they can make money in support of people that are at home. There's a big term in our industry right now, Michael, known as long-term care pharmacy at home, which is continuing services in the form of remote patient monitoring. It's constant touch, sometimes daily. And then when you combine that with Happier at Home, that means that someone's showing up at the house to do light cleaning, maybe some bathing, checking up on the individual in person. And when I start cultivating the perfect mixture of ingredients to prepare our community pharmacies to build business, long-term care at home, long-term care insurance is all part of this. This covers things like facility-based care. It might be nursing home, it might be assisted living, home-based care, skilled nursing coming into the home if there needs to be, therapy, physical, occupational, even speech, personal care services, homemaker services, meal prep, cleaning. So a shout out to our pharmacists and pharmacy owners out there. This is not the same pharmacy business model that your grandfather or great grandfather or even your dad or mom has been running. This is evolving, and Michael, we're getting away from the revenue stream where it's just a dispensing fee, because right now in our broken system based on the greed of the three largest PBMs, the only way that our community pharmacies are generating revenue is a flat fee or an adjusted fee onto the prescription, where you'll say, hey, the ingredients cost is $50 and we're going to give you a $1 dispensing fee. And then when that goes through the system, sometimes it's negative. There are prescriptions that go out of a community pharmacy that if they dispense that and they give it to the patient, put it in their bag and they leave, they just lost $3, they just lost $20, they just lost sometimes $60 to fill that prescription, knowing that it's in the best interest of their client and their patient to stay on those medications, to stay on that regimen. When I combine this with long-term care pharmacy or long-term care insurance, long-term care at home services, remote patient monitoring, Happier at Home comes in, it really gives me options to speak with that individual and their family to say, what's the best avenue for you? What's the best system? But the reason why I was excited that you were coming on the show today was the shout out to these people that are in their 40s and their 50s, maybe 60s, that they haven't started a program. Talk to us about starting as soon as possible and the advantage to that.
Yeah, 20s and 30s. I've actually had people who watch the show, 62, and they'll go, I'm 28, maybe I should do it now. No, I didn't mean to scare you that much. If you have good medical insurance, you don't need long-term care insurance yet. But in your 40s, 50s, and I'm so glad you said 60s, because I have friends, have said, oh my God, I guess I missed that boat. And no, we know each other. We play tennis. You're a non-smoker. You don't drink a lot. You don't have that health issues yet. You can still get long-term care insurance. So I think that's important to people in their 60s that are listening. Don't go, oh my God, I missed that boat. He's talking about doing it 15, 20 years ago. No, let's talk. There are products for you. But yes, in your 40s and 50s is when you're healthiest. And guess what? When you buy any insurance, when you're healthy, it's much cheaper. And what a time to lock in a price. And there are 5-year pays, 10-year pays, 15-year pays, where you can make payments on these products. And by the time you get to your 60s and 70s, it's a paid up policy. Mm-hmm. Now, for many, many years, the number one obstacle was, well, what if I don't need it? I mean, I'm just going to pick a number. I'm paying $300 a month for 15 years. That's tens of thousands of dollars. And then I just get hit by a car or I have a heart attack and I die. Oh my God, what a waste of tens of thousands of dollars. Well, the long-term care insurance industry heard those reasons. And now our products, which are called hybrid products, allow people to buy life insurance with a long-term care insurance rider or an annuity that pays them a monthly interest check with a long-term care insurance rider. So it's no longer just if I get sick, I need it. Now, let's just say somebody, buys a $500,000 life insurance policy, which in their 40s, is not that expensive, but there is a multiple of that life insurance that goes towards long-term care in their 70s and 80s. But oh my God, I never needed it and I died. What happened to that money? Your children got $500,000 in death benefit, by the way, tax-free, because all life insurance is tax-free. So these hybrid products where you can buy life insurance or an annuity, if you have an annuity sitting somewhere making X, and let's face it, it's finally paying some money. Todd, finally the markets have come back. People are complaining about high rates for mortgages. I do many mortgages for my senior clients. Well, when they were really low, you weren't making any money on your CDs and your annuities. You can't have it both ways. But if you have a $100,000 annuity and it's making you X, when it comes time to renew that, it's time to look at renewing that annuity with a long-term care insurance option. It's literally not costing you anything. But when you're 82 years old and you need $6,000 a month in long-term care, boy, does it mean something then. So again, the younger you do it, the better. But I guess my record right now is 68. I did do a great long-term care insurance policy several months ago for somebody 68. But oh my God, he was a year older than me and he looked like my younger brother. I mean, I was embarrassed. He ran every day. He did everything. I run to dinner, that's how I run.
I run to dinner.
But it's just, and the only thing I'll add is the longer lifespans have come from the staggering, and it's nothing short of staggering, medical and scientific breakthroughs of the last generation.
Yep. I
mean, I got shots when I was a kid for certain diseases that my children never got and that my grandchildren have never heard of. Mm-hmm. But what I'm hearing from the scientific community, and I'd like you to, opine on this, is that the improvements that are coming in the next 10 or 20 years make the last 10 or 20 years look like Fred Flintstone. That we're going to be, I had a medical expert from the from an institute in Israel, one of the number one medical institute in Israel in the planet, and who said, Michael, how old are your grandchildren? And when I told them, he said, Michael, your grandchildren will be playing tennis or pickleball in the heat of summer in Florida when they're 100 years old. That's what's just years away in medical advancements. So long-term care insurance is going to become an absolute key part of us living longer and having quality of life.
Hey, we'll be right back for some questions and answers with Michael and also connections with him here on TWIRx. 1 second.
Marketplace for independent pharmacies since 2010. Our network makes it easy to buy at the best prices and quickly sell your overstock. Just sign up and log in to get started. If you have excess inventory or medications nearing expiration, selling is simple. Just scan the square, set your price, and post. And buying is just as effortless. Search by NDC or drug name and compare the latest prices and deals across wholesale and pharmacy. Members love MatchRx because it saves thousands. Take Jennifer from Olympic Pharmacy, for example. She saved nearly $1,800 on a single order of just 5 medications. So join MatchRx today. It's free to join, fast, and puts your pharmacy first.
Medicare open enrollment begins today.
And this year there are a lot of changes that applicants need to know about. Our Saquon is live in St. Paul talking about these Medicare Advantage plans, breaking down what people need to know. Good morning, Say.
Hey, good morning to you. Well, we know over 150,000 people here in Minnesota are now going to need to look at some new coverage options due to some of those big changes coming, which I'll break down here in just a second. But we also know, actually, in just less than 2 hours here, a Senate committee is going to be hearing directly from consumers along with insurance and health experts on how those changes coming to the insurance market are going to be affecting Minnesotans. So as you look around at some of those options during this enrollment period, it's also important that you know exactly what you're looking for. Let's start with some of those big changes, though. We know several major health insurance companies are getting ready to scale back on their Medicare coverage by limiting it to select counties or canceling those plans altogether. Now, that is the case for Minneapolis-based UCare, which announced recently that it is dropping Medicare Advantage next year. Now, there are 2 parts that can be included in what's known as Original Medicare. Part A covers things like hospital or inpatient care, and you also don't have to be a network. You don't have to pay any premium premiums for this, but there are deductibles and copays. Part B, on the other hand, covers doctor services and medical supplies. This one does require you to pay a monthly premium. Neither part, however, covers prescription drugs, but those costs are covered through the Medicare Advantage plan, which is entirely different from original Medicare. Stick with me here. With Medicare Advantage, you must already be enrolled in original Medicare or Parts A and B, and you need to be in network unless it is an emergency. This plan also has limits on out-of-pocket costs, unlike A and B. This open enrollment period runs through December 7th if you are looking to change your plan. And for those of you who are losing your plan, you have until December 31st. I know this is very complex, so if you are looking for some extra guidance here, you can always call 1-800-MEDICARE, or you can contact Minnesota Aging Pathways, formerly and better known as Senior Linkage. We also have a bunch of information on our website right now, including the answers to some of your most frequently asked questions regarding all things Medicare. You can check that out on our website right now, fox9.com. Guys, back to you.
So that's a good example, Michael, of just the basics. And I didn't hear anyone mention the need to invest in a long-term care policy that would fill in the blanks. And sometimes those blanks can be astronomical depending on the situation. So let's give some guidance to our listeners, our pharmacy owners. What steps can they take to engage with you, to have references? I know you're in the Tampa area. Shout out to one of my favorite pharmacies down there called Palms Pharmacy. We're going to have to get you connected with Shahida.
Absolutely.
But give our listeners, give our pharmacy owners some guidance as to what steps they can take to informing and educating their community about long-term care insurance.
Oh, I appreciate that. Well, easiest way, of course, would be to go to our website, www.62whoknew.com, and just click on the long-term care insurance link. Not only will you get a free guide about long-term care insurance, but, we will have literally, it might be me, but it might not, but a national expert in your area. That was just Minnesota. Medicare and Medicaid rules are different on different states. It's not going to be Mike Banner in Tampa calling a Minnesota client of one of your pharmacies, but it will be a Minnesotan long-term care insurance expert. So go to our website, click on long-term care insurance, and we'll contact you as quickly as possible. The other thing I'm going to say also, again, because we are in open enrollment season starting today. And I take this quote from Tom Hegna, who was just on our podcast, who is the #1 speaker on annuities, #1 annuity authority in North America, Tom Hegna, Hegna. And one of the things he always says, and it's so true, retirement is not a do-it-yourself thing. I have so many friends that go, oh yeah, I know there's about 25 or 30 different Medicare plans. I went online last night and I researched them all. And I go, what? I'm doing this 20 years and I don't even know a quarter of them. You research them all. Yeah. And I picked one. Use an expert. Like all insurance, it doesn't cost you anything. And again, I'll refer you right back to www.62whoknew.com. Click on the link Medicare Nation, and you will be able to speak directly to Ms. Diane Daniels, the founder of Medicare Nation, and a nationally well-known speaker on all things Medicare. And if she helps you get your Medicare, the carrier pays her, not you. She knows all 25 policies. You don't. Like Tom Hegna always says, retirement is not a do-it-yourself project. Use experts. So to all your pharmacies out there, please, direct people, if not to 62 Who Knew, somewhere. This would be like them coming in with a prescription to your pharmacy and having the pharmacist go, you know what, I'm going to take a lunch. Come back here, make your own medicine. No, don't do that.
Right.
And again, think about that long-term care insurance in your 40s and 50s. If you're in your 30s, let's start thinking about it for mom and dad. Mm-hmm. And if you're in your 60s, even 70s, maybe, it's not too late.
Awesome. Michael, this has been great. I appreciate you being on TWIRx today. We want to ask that you come back sometime and let's get a panel discussion going with some pharmacy owners who have on both sides that have patients and have clients that use a long-term care insurance benefit and the benefits that provided them. And then the other side is the pharmacy owners who really don't have a program set up that they should to really help to fill in these big gaps sometimes for people that want to stay in their home or they want to have care. And there's ways to do this. And like I said, I mentioned all the puzzle pieces that we can build together and customize for these people. But Michael, this has been special. Thanks for being on TWIRx.
Thank you so much for the opportunity.
To TWIRx, exciting day here as we're preparing for the NCPA in New Orleans. If you're going to the National Community Pharmacists Association, it's the Super Bowl of independent community pharmacy. I always think of things in football right now. I'm excited about this season. Not a good day here on Friday, October 17th for the Pittsburgh Steelers and their loss to the Bengals. Not cool, guys. If you could lose to teams outside of our division, that's kind of the better loss if you have to have a loss. Hey, we have a lot going on, but before we get into our next segment, I want to welcome a friend of mine, someone who's taught me a lot about the business of pharmacy and an entrepreneur who has built an incredible organization tied into the independent community pharmacy sector and the success of pharmacy owners, the original, the OG, pharmacy badass, Dr. Lisa Fast. Welcome to TWIRx.
Thank you, Todd. And I got to say, I don't have any skin in the game between the Steelers and the Bengals, but since my best friend and right-hand woman, Heather Haro, is a diehard Bengals team, I'm going to have to kind of go with her on this one. And it was a good week for the Bengals.
It really was. They pulled it out. I was watching the beginning of the game and thought, oh, yeah, we got this. And then, no, we don't got
that.
I'm excited to have you here. You haven't been on TWIRx in some time. That's definitely both of our faults with the lives that we lead.
Yeah.
Between now and March 28th, you and I and a bunch of different people that are part of the Super Bowl of charging your pharmacy up through profits, the Pharmacy Profit Summit. I'm excited about this one. This is going to be the biggest one ever. You shared some news with me about the size of the opportunities of not having the constraints, and I'm excited, Lisa. Talk to us about Pharmacy Profit Summit 2026.
You know, I love putting together this show. I will say selfishly, I put it together for like what I want. I mean, I'm still a pharmacy owner. I own 2 pharmacies. Not only do I work with hundreds of pharmacies in Pharmacy Badass University, but this is still the life that I live daily. And so I spend a lot of time and effort also going to other industry events. So I attend a lot of marketing events, a lot of other healthcare professional events. And that's where I gather. It's almost like I feel like I'm a little gatherer of people, and I find people that are outside of our world that are just doing amazing things and transforming lives in their own space, and bring them back to pharmacy. Along with, just one of my favorite things is to get pharmacy owners on stage for the very first time. And so I have a long record of doing that with pharmacy owners that just become amazing people, like Adam Robinson, for example. And, and so anyways, yes, we moved properties. We were at the wonderful Omni for the last several years, but we were outgrowing it. We sold out every year. We couldn't fit in any more exhibitors, couldn't fit any more attendees. And so we have moved over to the Hilton Anatole, which means we have wide open spaces. And we have a great Western theme this year. Even though we're in Dallas, it's actually the first time we're having a little fun with cowboys and, Western. So it's definitely going to be fun. But for me, a summit, if you're a pharmacy owner or pharmacy employee, taking time away from your pharmacy is just one of the most costly things you can do. And it's not necessarily monetary costs, but the energy, the time, the worry, right? It's like, is everything going to be okay when I'm gone? Plus the money, right? Plus, the hotel and the airfare and whatnot. And so for me, putting together a gangbuster show for pharmacy owners that makes it not only worth their while just a little bit, but like over an abundance worth their while. And so our content this year is just, I mean, I get goosebumps right now just even talking about it. Like, it is going to be life-changing, business changing. That's what I'm all about. I'm on a mission to save independent pharmacy. And I think one of the best ways to do that and help pharmacy owners love owning their pharmacy again is helping them create a pharmacy that's continuously profitable, right? Not just profitable for what's going on this month, because we all know, no 2 days stay the same in pharmacy. So you need systems and structures that are going to keep you profitable now, next month, next year, and the next decade. And so that's really what we're all about. And so I don't think there's any show that put together the types of things, both from inside pharmacy and outside pharmacy, that's going to have that kind of impact. And so I'm super excited about this. I get to talk with these speakers and work with them for almost a year before like I announce and whatnot. And they've changed my life already. I know they're going to be life-changing for you. I think one of the biggest impact, and also he's the most like under the radar. He's right there on your screen that you're showing, Bradley James Davies. He calls himself a professional listener. And you would think, oh, listening, like, hey, I'm a healthcare professional. Like, I do that pretty good. And man, just having this new friendship with him and talking with him, he has already changed my life, just as making me aware of how poor I was listening before and how critical it is, not just for improving your business and improving your bottom line, but improving all the relationships in your life. And I think that's the one that subtly, I think there's a lot more sexy sounding speakers, AI bots, delegation, and, that kind of stuff. But I think when people leave the 2 days at the summit, they're going to point back to Bradley's and be like, that was the one that was like mind-blowing, because the skills that he's going to give you, you can literally apply to any aspect of your life. And I thought I was a good listener, like it was one of those things, but it's like, you didn't know the measuring stick. And so once I learned what that measuring stick was, I was like, wow, I can get better. And so life has definitely changed since becoming friends with Bradley.
It's incredible. This conference has come such a long way. It'll be the 8th Pharmacy Profit Summit for 2026. This is just an incredible time of coming together. The energy at this conference is so high that it's exhausting afterwards. I need kind of a couple days, as I'm sure that you do, to recover from it. But I'm a shout out to our pharmacy owners, pharmacy operators, people that want to expand, build other pharmacies, build other models. Come to this. It's a workshop. It's an inclusive environment, as well as when we take the breaks, we go out to the exhibitors. It's a fusion of ideas. It's people taking what's happening on stage and then coming into the networking through the exhibits and coming together and speaking about it, but then going to an exhibitor or a technology provider, or someone's going to be there that's going to help you actually build that and then talk about what the next steps are, so that when you get back to your pharmacy on March 30th, you are ready to implement something that's not only going to change your business, but like Lisa said, it's going to help to change your community and strengthen your community. And this is during a time where pharmacists are collapsing everywhere, including some of the news that's coming out of the ending of the very last remnants of Rite Aid. So this is the time.
Yeah. And to that point of implementation, it's a good thing to go to a show and have some of that, team spirit and rah. I'm not against that in any way, shape, or form, but fundamentally, I'm about changing pharmacies for the better. And I don't think any other pharmacy show does this, but we obviously provide support for our members, but we also provide support for attendees. We actually have a structure for, you don't have to be a member of Pharmacy Badass University, but we offer every attendee coaching calls with our coach Mike. We offer group sessions post summit. We want to support you. That stuff happens for 90 days after the summit to be able to help you to implement. Now, obviously you get a lot more as a Pharmacy Badass University member, but we don't want you to just buy a ticket and come for a fantastic 2 days. I mean, yes, that's great. But if you don't change anything in your pharmacy after coming to my show, I feel like I failed. And that's a crappy feeling. And so we started doing this because I don't want to feel crappy. It was purely selfish. I want to feel good that people come to our show and then actually go out and do things and change things. And so not only do we present them in a way that they're easy to implement, but we also provide the structure to help keep you, accountable to help you do those changes.
Awesome. That's awesome. Excited to be there. Excited to be back. And what's the location? It's the
the Hilton Anatole. So still in Dallas. So still easy to fly in. The 2 airports. We've got it as a Saturday, Sunday this year. So you could fly in Friday night or even early Saturday morning, depending on where you're at. Fly home Sunday night. And that way it's minimal time away from your business, minimal time away from family. And so, yeah, I'm really excited that we were able to get that Saturday, Sunday schedule because I think it just makes it easier for pharmacy owners to attend. But yeah, Hilton Anatole. So new property, which is going to just mean we have lots of extra space and lots of extra things that we can do that we've kind of just been restricted in the last couple of years.
It's good news, Lisa. It's amazing to see this thing exploding like it is and growing, and it's meticulously growing. It's not like you just do things. I know how it's your pharmacist brain that you're always looking back on what you did to not only improve upon, but be strategic about it. That spills over into the client too. And it's practicing what you preach, and it's practicing what you're doing all the time as a pharmacy owner yourself. So excited about this. Thank you so much for being on TWIRx today. And listen, TWIRx listeners, this week in pharmacy, we're going to have people that are part of the Pharmacy Profit Summit come on the show to kind of give us a progression of some of the additional things that that Pharmacy Profit Summit is going to cover. Once again, if you haven't attended, you have a special going on, but it's for signups or something. You said first-time attendees, right? Right, Lisa?
Yeah. So, well, for our Pharmacy Badass University members, they get a discount on Pharmacy Profit Summit tickets. We actually have an entire discount program of over 40 partners where we have discounts for Pharmacy Badass University members. And you get the discount even at the lowest basic level membership, which is $100 a month. So we have people who join basic level membership just for the discounts. They don't even have to pay attention to the revenue generating ideas. Of course, I recommend you do, but the discounts for themselves pay for themselves. And so if you want to come to the summit, you can instantly make your money back by joining membership at the $100 level, and you automatically make double that back because you save at least $200 depending on when you buy your ticket as a member. So if you want the lowest price summit ticket along with saving money in a bunch of other areas for your pharmacy, joining Pharmacy Badass University at the basic level membership is an absolute no-brainer.
That's awesome. Excellent. All right, you heard it here. Check it out. If you're driving, if you're doing something, you can't use your hands, don't worry. There's going to be a link to this event in the show notes. Be on the lookout for more information coming to This Week in Pharmacy about the Pharmacy Profit Summit. Lisa, it's so good to catch up with you. Will I be seeing you in New Orleans?
Yep, I will be there flying in. I'll be there all day Sunday and most of the day Monday. But yeah, mom has water polo stuff. So.
Yeah, holy cow. Your son is a Olympic staging
he hopes to be. So, but he's got to do his duties and make it up through the ranks. But yeah, he was actually just got. I'll brag for a moment. He got best goalie in his district for the year. So those awards just came out. So we're proud of him.
That's incredible. I was a swimmer all through high school. Started when I was in 8th grade competitively, but I was in swim team before that point. And when we used to just do pickup game polo stuff, that was a great way of our coach would make us do it as a way of training for being able to swim, especially for the longer distances. That's a whole nother level of swimming in an exhaustion when you're playing water polo. That's crazy.
It is. It is one of the most difficult sports. Of course, we've become a lover of it. So
incredible. All right. We will see you in New Orleans. And Lisa, thanks for being on TWIRx.
Thanks for having me. See you soon.
Feeling lost with the complexities of pharmacy accounting?
In pharmacy today, there's so many different, variables and issues that impact the pharmacy books, records, accounting, the profitability of the store, so forth. There's different components of pharmacy that have its own nuances from an accounting standpoint. And so it's tricky. There's no doubt about it.
Ready to take your pharmacy to the next level, but don't know where to start? Sykes & Company is here to help. Introducing the RX Assessment. With the RX Assessment, the pharmacy CPAs and advisors at Sykes will do a deep dive into your accounting and tax situation and give you the action steps you need to take your pharmacy to the next level.
If you're interested in, working with a team who understands the industry and how the accounting and tax should really be in a pharmacy, this is your chance to get a under the hood check of what's going on and getting the feedback of any issues or concerns or, again, things we think you're doing really well with.
Get the financial checkup your pharmacy needs and head over to sykes-cpa.com or call 252-482-7644.
Hey, and on This Week in Pharmacy, we have a special segment coming out of news. We had a lot going on. I still want to talk about some of the news, and I held back on some of the clips that I wanted to share with you because of this crew that's coming on next. Not sure if you've heard of these guys, but this is the crew that's running the RxRated podcast. I'm so excited to be featuring them. I want you to check them out at Rated RX podcast. That's Rated RX podcast, and follow them, subscribe. They have some hilarious episodes. And without further ado, I'd like to bring the RX Rated crew, the Rated RX crew. I got to get that in line because of my original Rated RX or RX Rated podcast. So I'm fumbling with that, Robbie.
It's all right. It's tricky. I get it, man. It's okay. It's hard to readapt. So I forgive you, Todd. It's okay. Well, hey guys, thanks for having us. We're really excited to be tuning into TWIRx this week. I'm Robbie Bossy. I'm here with Sam Lona and Xavier Hill. As part of our show, we like to just sort of embrace pharmacy culture, talk about big concepts, talk about funny things. But today, I think we're going to keep it a little serious for you guys, and with one of our segments called the Weekly Weigh-In. Sam, please take it away.
All right. Thank you, Todd. Thanks for the intro here. So we have a weekly weigh-in, a little clip we like to do on little questions that get sent into us. People want to know pharmacy stuff. So this week looks like we're talking kind of about pharmacy school and ideas of pharmacy coming up. So the question is here, what misconceptions did you have about pharmacy career paths, either clinical, community, industry, anything along those lines, when entering or during pharmacy school while we started? So any initial thoughts that came to mind for you guys?
Robbie, you want to lead us off?
Yeah, as far as misconceptions go, I guess I never really understood what industry meant when it came to pharmacy. I had friends who, did fellowships and stuff like that, but I still didn't really understand until they were in the thick of it. Then I realized, oh, hey, this is more research-based stuff. But as far as like other misconceptions, your grades. I'll start with that. It is very important to get good grades while you're in pharmacy school, and it's something I still obsess about today. I'm taking a Japanese course, and I was actually just complaining to Todd about this, about, still like wanting to learn and still wanting to get A's, even though it doesn't really matter anymore. But even after pharmacy school, after you pass your residency, if it's something you want to do, it doesn't really matter. And even to get into a residency, that's where it's most important. But once you graduate, I haven't had any employer say, what was your GPA, or have it anywhere on an application that says, what's your GPA? So I can assure you guys, after you graduate is a lot better and a lot easier. So just keep your grades up where you can, but know that no one cares when you're done with school, thankfully.
Yeah, I remember my last rotation having that thought of like, I don't really care about what this grade is. Like, I'm more at this point just trying to learn as much as I can. Like, I want this knowledge, and getting a little bit in trouble because like I wasn't doing what the preceptor wanted, because it's just like, this is just busy work. Like, I don't care. Like, I'm trying to learn this cool stuff that you guys do. I don't care about this grade. And so trying to hit that same kind of realization that you were talking about on those grades.
What do you think about residencies though? Do you hear that a lot at all doing residencies?
And grades needed for it?
I mean, just like needing to do residency after school.
So my first thought on this question, just related to that, was I'm pretty sure it was in Tillman's class, so something that we were doing, and that first year, always hearing about residencies and like this is kind of like not necessarily what you're looking for, but they just keep bringing it up over and over and what this thing is and wanted to do this and whatever to get into this specific residency you want cardio, you got to do this. And I remember writing in some response being like, okay, like I guess I need to go into residency. Like I didn't realize that going in here. But I guess this is how you have to proceed to be a pharmacist. And I'm pretty sure it was Tillman, and bless her heart, was just responded back to it in the message, just like I understand, like that's what it sounds like, but believe me, most people are not in residencies or community. It's completely fine. It's where most people are, and like there's no issue with that. And so it felt that kind of swing of being like, I guess you have to be the top 10% of your class or else you're completely useless. And then Tillman being like, no, that is not true. That is not how this works. And going through that transition. Luckily, I think it was our P1 year. So, there wasn't too much of that stress going on.
Nice.
Yeah. Another thing that is a big misconception as well is I remember going through the skills labs and they had all these mock patient counseling sessions where you had to say so much, make sure you hit all these points. And while I was very grateful or it made me comfortable talking to patients, realistically, you don't have that much time to talk about all that stuff. I mean, in my setting, I am a little luckier because I'm like in a hospital and it's literally my job to make sure they understand and go. But when I was in community, people didn't care. They just wanted to know, like, hey, do I take that with food? Do I not take that with food? And they'd be on their merry way. So because you have like a million things you're juggling. So I think while you're in school, spend time learning everything, learning the side effects, learning the main counseling points. You should know these things. They're going to ask you these things, but you might not have time to discuss all these things. So it's very important to know how you know how to manage your time and then give the patient what they want, what they need at the time. But don't beat yourself up if they don't want to hear everything you got to say. So just that's a big misconception. I think I realized out of school pretty quickly.
Nice. Yeah. It's a lot a lot of stuff we don't know about pharmacy going in, especially as a student. If you weren't exposed to it, you probably didn't know a lot. I know me, I originally wanted to do community or independent pharmacy because that's all I knew. And I recently went home this past weekend. And I went home to look for my Pokemon card. Well, I went home for homecoming. But
Pokemon cards. I heard Pokemon cards.
I went to look for my.
I wear Pokemon cards.
I had some old Pokemon cards, and I was like, I wonder if I'm going home for homecoming. I wonder if I still have those. I couldn't find them, but I did find a old journal where I had to write essays and for English class. So back in 2010, 10th grade, I found a journal article or essay for my English class. It was like, where do you see yourself in 20 years? And I literally wrote out my entire life right now as it is, minus the hospital part. But I was like, I'm going to be a pharmacist and I'm going to own several pharmacies all around the world. So I really thought I was going to be an independent pharmacy owner and just have pharmacies all over and be a billionaire by now. That didn't quite work out, but I did.
A few more years.
I did become a pharmacist. Yeah, a few more years, right. Maybe with the podcast, we'll take over.
Mm-hmm.
But I did actually become a pharmacist because at that time I didn't know that pharmacy was so diverse. I didn't know they had industry pharmacy. You can go into the hospital. You can be a public health pharmacist, managed care, compounding. I didn't know all that existed. I just thought it was just regular community pharmacy. You come get your meds, give them to you, put it in the bag, and then you're on your way. So it was really cool to look back and see like what I thought pharmacy was at that time. So after going through pharmacy school, I did different rotations and tried out different things. I really fell in love with the inpatient hospital side of pharmacy where you could work with the doctors and talk with the nurses and really do more high level stuff and manage heparin drips and dose complex antibiotics. I really enjoyed that part of it. And it was totally different than what I expected. So it's probably a lot of misconceptions out there until you really get into it or really do your research on it and figure out what it's all about.
That's so hilarious to say that, because I also wanted to own a pharmacy, and I initially did my PGY1 in community pharmacy, and I selected this pharmacy because, or this PGY1 because they were like, when I interviewed, they're like, yeah, we'll teach you how to run a pharmacy. You'll feel good. You feel competent. And I was so excited. And I remember like my first day actually meeting, not with the residency director, but the director of pharmacy, who was in charge of like 20 some stores. I remember him, he looked at me and he said, do you really think you're going to be making a lot of money owning a store? And I was like, what do you mean? Like, I want to own a pharmacy. I want to be my own boss. He's like, no, I think
No,
you
don't.
might. Yeah, like your mind's going to be different by the time it's done here. And so I was like, okay. So I had a misconception as a student here. And while the residency was great, it prepared me, but I eventually became a manager at a little independent store where now I got to see all the bills and transactions, the things that I couldn't see as a pharmacy resident. And I remember hearing the owners complaining about, not getting enough money, these kickbacks, like, oh, what are we going to have to cut? We're going to have to cut hours. I remember thinking to myself, like, I don't want to do this. This is a nightmare. I don't want to be worried about, like, can I keep the lights on this month, or how much, and they sold alcohol, they sold beer, but how much beer am I going to sell so I could, just be afford to buy something expensive medication to keep it on the shelf when it's needed. And that's when I learned real quick, like, you know what? I don't know if this ownership thing is for me. I'd like to pursue it, but unfortunately, it's just, as we talked in other episodes, it's sort of controlled by these big corporations and PBMs that play a little foul and dirty. So thank God I'm somewhere else now, but definitely a lot of misconceptions. Yes. Hey, Todd, you got some feelings on that. I heard someone say boo. Is that you, Todd?
Yeah, that was actually Sam booing, but
Sam booing.
I agreed with him. The bane of our pharmacy industry is the three biggest PBMs controlling 82% of all the prescriptions.
82%. Wow.
It's just crazy. It's just crazy. But hey, talking about the future, and I have a chance to meet with WVU Pharmacy P3. Shout out to the P3 class of WVU. But I go down there and talk with them, and it's a tough love presentation where I'm talking about what's really happening in the trenches of specialty, community, hospital system, entrepreneurship, artificial intelligence impact, policy, politics, wokeness, I kind of like roll it all up into the real world, and we have a ball. It's been my fourth time to share with them and get a lot of information that they might not get from someone who's been 22 years now observing what's happening to our profession and how pharmacist roles are changing, and your imagination, leverage of ChatGPT and the use of AI to assist you, and acceleration of data and study. I mean, it's a new age in being a pharmacist, but it's not I don't see it as a negative. I see it as reinventing what the pharmacist was kind of always supposed to be, and driving things without it always having to be connected to a dispensing fee. I think pharmacists in my living future, I got 25, 30 years left in work, and I think I'm going to see it when pharmacists are primarily paid as providers and clinicians, and not by the dispensing fee. I think the dispensing fee model has run its course.
Yeah, I agree.
Definitely with the PBMs going right now. That's just squeezing that more and more.
True.
That Robbie was talking about.
Yeah. Another misconception, and I'm so glad you brought this up, is AI. I hear a lot, especially online, like, is AI going to take over your job? And I know we had this conversation about this in the episode that you featured on our show, Todd. But, speaking as someone who works in the career actively using AI, I think we're all guilty of this. Sometimes you're doing a CE and you're like, I don't know the freaking answer to this. And, you pop it in just to get an explanation, and they'll still get the dang question wrong. So I'm just like, okay, clearly AI isn't getting this clinical sense that I'm not getting either. So I don't know if that's a good thing. Neither of us getting it at the time, but it can't do that job. So I wish as a student, though, I did have AI available, not in a sense to like cheat and like get answers and write my papers, but now I use it to help me study and do CEs. Like I can't tell you how many times I'll take the PowerPoint that's just like this big old file, I'll pop it in and say, can you organize this for me? This, and it spits out a study guide for me. And I wish I had that, because I can't tell you how many late nights I spent organizing it the way that still didn't make sense to me. So I don't have the best handwriting, so I wish I had AI at the time.
Yeah, I would have definitely used the AI to study for sure. I would have had it like, all right, quiz me, ask me like, here's my questions, quiz me, and I would have been going through it like, all right, how can I get this right the next time? I got it wrong, let me know, and I would have been running my ChatGPT bill up for sure.
Yeah. Well, I don't know, man. If it's quizzing you and it's still wrong, I don't know if you could trust it.
Well,
so.
I mean, I'm going to use the correct information, like,
Yeah.
like give it a screenshot from the book or something,
Yeah, have it spoon feed you the information. I think that's the best way to use it. Have it spoon feed and organize your information. But
it's getting there. It's getting there for you. So then for rotations, or I guess in general, anything that you guys had that an instance, moments, assignments that made a difference for you for these students that might have also been a misconception versus it being didactic versus your more clinical experiences you guys had?
I think that one rotation that stood out to me, and this was actually something I was considering as opposed to doing community, is what I'm actually doing now, working in mental health. So I remember doing this rotation and everyone saying like, oh, it's really cool, but you have to be very, very careful. You're working in public health. You got to worry about not public health, but psychiatry. You got to worry about your safety. And there were some times it did feel a little maybe scary, but it was such a good, meaningful rotation because I got to see people come in disheveled at their worst and then leave like at their baseline best self. And that was just such a rewarding experience. And that was something I wanted to pursue, but in my head at the time, I was like, no, I want to do community pharmacy and I want to own my own pharmacy. And so I was a little hell-bent on that. And it's just so funny how life works because I got that experience and it inspired me. And that's what I'm doing today. So my little tidbit for students is really engage in your rotations there. You might have your one set goal to do one thing and life might take you a different way. You already have your experience doing it prior and you'll have some sort of sense of what you have to do to make that permanent. So really enjoy those experiences, do as many as you can. And just go from there and go grow.
Nice. Yeah, I totally agree with that, Robbie. Just really experience it and kind of go from there. For me, a big misconception from going from the classroom to clinical rotations or going to your job is the communication. You think the time and communication, right? So you think you have time to sit and go over this whole article or present this whole presentation to the doctor, where the doctor like, all right, give it to me in 10 seconds. Tell me what you want me to know in 10 seconds. Like they don't want you to sit there and talk to them all day. So you have to figure out how to communicate effectively and deliver the information. And same thing with the patients. You have to be able to deliver all the knowledge that you have and break it down, dumb it down for them to a way that they can absorb it. So they can understand what to do with their medications, side effects of their medications, how to take their medications, and also do it in a decent, small amount of time. Sometimes they don't want to sit there for counseling for 30 minutes. They got to go, pick up the kids from school or something, or they got to go take care of their grandmother or something. So you have to be able to communicate and deliver all your information in a small amount of time and efficiently once you get out of the classroom and into the actual practical setting. So it's something that can be a misconception, that you have enough time to actually just deliver a large amount of information.
Yeah, time's limited for sure. I guess mine related to that communication is maybe the first time realizing, you can really only control what you can control, and the patients are going to do what they want, and they're not going to listen. They're not going to listen to you on some things. And what came to mind was being in hospital and essentially someone leaving against medical advice or medical care. And, they were pretty serious, had a serious bacterial infection. They didn't want to be treated. the whole team going down to the front and like the U-turn in front of the hospital and trying to like talk to him, and the resident, the attending are all there, and I was like standing further back, but they're like, you have to take these antibiotics, you have to stay here, like you are not going to make it for in the next week or two. And him in a wheelchair pretty much rolled down the end of the block, like wouldn't listen to him. Finally the family came over in their minivan to load him up, but he was just adamant. It's like, no, I'm going home, I'm not doing this. And regardless of how good the medicine was, how well the team was able to decide what they needed, how to help them, at the end of the day, patient didn't want it. Patient wanted to go home, and that's what happened. And I think realizing that you can only do so much, and you got to be, at some point, you got to be okay with that it's not on you for that situation.
I bet that guy just wanted to die in his bed, honestly. Like that sort of thing. It's like, because there are a lot of emotions that go on when you're sick, and you're just like, no, I will not die in this hospital. I will die in my bed. So I part of me wonders, man. Part of me does wonder.
Possibly.
Maybe.
Or you just want to go home, feed his dog, and then come back the next day.
Yeah.
I just want to die in my bed making love to my wife. That's
the way to do it.
That's all I wanted.
You can make that happen anytime, Todd. If you think about it.
All the time, but I'm not old enough. Like I want to be like 102 or something like that.
It doesn't have to be age, though. It could be an accident. An accident. Yeah, you got to get life insurance policy.
Hey, I want to shift gears on you guys because something's been bothering me this week, and it started with this post. So I'm gonna bring this up from Instagram.
Oh, it's me. What's up?
You talking about our horrible, absolutely horrible political climate that has impacted healthcare way too much, in my opinion, and how it's gotten like that based on the sickness that is social media. As wonderful as social media is, it's also, it's also in some ways very horrible. And it just and so there was a follow-up post around this subject of politics from a very good friend of mine who is known. His name is Matthew Zachary. He's the founder and a cancer survivor of Cancer Sucks. And he now runs a podcast, enormous podcast, hundreds of thousands of listeners, called Out of Patience with Matthew Zachary. And he posted on LinkedIn a really good post that goes down into the whole element of why in the world are we experiencing measles again at a time when it was supposed to have been eradicated. And when you start drilling down in through the data, you find out that people are not, vaccinating their children for measles, and it's like it's popped its ugly head up again. And I think that in of itself in 2025 is absolutely horrific, and it shouldn't even be a thing, and it frustrates me. Now, with that, if someone's to listen to that section of my rant, they may think, oh yeah, this guy's he's woke, and he's all liberal, and he's really
why is good health policy woke? That doesn't make any sense. It's such a stupid labeling. It's so dumb. This is what I hate about politics. Sorry, Todd. It just really grinds my gear that a good health policy is a woke policy.
It's not. So the whole post is, I made a comment. I called out, and it upsetted some people, but I called out the system, and whatever we call the system lost the public's trust. It wasn't the public that's all to blame for this. It's not Joe Rogan. It's not Donald Trump. It's a cultivation of ranting and of cancel culture and all this stuff that has kind of bubbled up to the unfortunate of where we are today. And I want healthcare providers to call the system out and say, during the pandemic or during this time when the opioid epidemic was having, the systems, the FDA, the CDC, these organizations that are supposed to protect public health, betrayed public health to make money or to advance an initiative. And sure enough, the public's trust started to disintegrate. And then, of course, you pour gasoline on that with social media and with, crazy HHS directors that don't have PhDs or an MD or, that are running the whole country's health and human services. And I'm standing there kind of in the middle of it all. Like, I'm not on this crazy radical side, and I'm not way on this, and I'm standing where I think the majority of everybody is standing, kind of in the middle of it all, and saying, like, this is really, really effed up. Like, it's really jacked up.
I totally agree.
Yeah, I think people got hurt. I mean, you can say or point to one thing. It's like, scientifically, yes, this is wrong, but obviously there's a lot of people there listening and believing. And it kind of, as you're stemming, it came from someone getting hurt, prices being higher, couldn't afford something, didn't believe in this, whatever it might have been. They're hurting from something, and they hear this voice, and that's what they end up following. So, we having more science background than most people, know that there's some serious holes, some serious problems in what's being said. But there are so many people that are, they're looking for that help, and this is what they see. And so, as you're saying, it sucks from a science standpoint. It sucks that this measles coming back. We're not hitting those 95% cutoff rates for vaccines for herd immunity. It's just continuing to cause problems for people, and we got to get that trust back. And it's not going well.
Yep. Very much so. Agreed. I have a book that I'm reading now, and gives kind of like credence to the whole trust factor. And when I think of pharmacists, I think of trust, because you're the most trusted healthcare providers out there, more than. So this is a book by David Hardsager. I'm sorry to mess up his name. Horsager. Anyway, so he's the CEO of Trust Edge Leadership, and I got to see him talk at a conference of one of our clients, Framework LTC, pharmacy software system dedicated to long-term care. And during their user conference, got to hear him speak on how important today trust from our providers is more than ever, because of these fractions and because of these cracks in the stage of healthcare in the United States that we're in, not only from the payment perspective, but also from the delivery perspective, and how our physicians and pharmacists and nurse practitioners, they're held hostage to systems, and they're held hostage to big insurance providers, and they're held hostage to elements of the business of healthcare that have no business standing between a patient and that provider. And that's part of that trust element that we got to get back. We have got to get that back.
Yeah, and unfortunately, I do think it's going to get worse now that this political shift has now become like, hey, you guys took money from us, we gave you grants, we want a stake in your company. And that in itself is a little scary, because now you could theoretically have the government direct a company to do what they want them to do, and rather than a company pursue and seek science. So I do fear how things are going to look in 10, 15 years, and see how, politics are going to play a role in directing a company to do one thing over another. Hopefully, they will re-earn the trust of the public, not just healthcare providers, but, politics. But I don't think anyone will ever trust a politician, but that's another rant for another day. But yeah, I'm just worried, because we talked on a show before, our last episode, the thalidomide tragedy, right? Like the big crisis that was averted here in the United States, because Dr. Oldham Kelsey basically was like, no, I'm not approving this drug. And this company multiple times tried to get this drug approved, and she kept saying no. Meanwhile, in Europe and in Canada, they started having these malformation in babies, but that was largely prevented in the U.S. because they listened to experts. And now, because of this political shift and no one wanting to do it anymore, we have these raising rights in measles. And unfortunately, it's now becoming socially acceptable to be like, yeah, measles rates, ha 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 ha. You know, it's like I think that was the post that you pulled up about the betting. I don't know if that's the one you pulled up, Todd, but you know, I was just so blown away because I was on this app, you know, looking at random bets, just goof off, and I saw this post that was like, hey, do you think there'll be more or less than I think it was like 1,900 measles cases by the end of the year? If you put in $100, you can make $150 if it goes one way. And I'm thinking to myself, like, this is really effed up. Like, we're literally betting on sick people right now. Like, you know, it's like we're so desensitized to this, and it's screwed up. Just very, very screwed up. But what are you guys' opinions on that? How we're desensitized to these things these days?
Yeah, well, first of all, the U.S. is just full of degens and gamblers for sure. So we'll bet on anything.
Yes.
But yeah, we're definitely desensitized to, you know, it's hard to know what's right and what's wrong. So we need more people out there that, giving the research and the education and just explaining what's important for us to follow health wise, versus just, you know, getting all your information from TikTok or Joe Bud from up the street, right? So it's hard to, you know, to really just get good information out there. So they need podcasts like ours and other podcasts on the Pharmacy Podcast Network, and, you know, reputable people out there just giving out the good information, you know, so that everyone can kind of know what to do and know what's right for our health and build on that and go from there and regain the trust.
Yep.
I do think there's some pages that you could follow, though. You know, there's one particular page on TikTok I like called, I think it's Dr. Anti-Hero, and he literally calls out other healthcare professions too, specifically chiropractors. This guy has a vendetta against chiropractors, let me tell you. but you know, he'll like pull up a paper that they think they're referencing and just like, but it's just like, you know, while it's entertaining, it's sort of like, yeah, we should correct them, but I think you should focus your efforts on the politicians here, because they're the ones who are the ones with power and actually impacting our health as a country.
Yeah, there he is.
That's the guy. Yeah, he's a good one to follow.
Yeah, I think I've seen him before.
Yeah.
But like when last time we were talking with Todd, going over this online stuff, it's fortunately or unfortunately goes down to the user and what they want to look at, what they want to believe. So yes, trying to get all that out there, but it's tough when it doesn't really matter what you say if they're not caring.
Yeah, that makes me think of something else too. Like, you know, a lot of AI videos are out there, and people who don't know any better are believing, you know, certain AI videos, and they got some good ones out there that you can't really tell that well. Usually, I mean, because they usually use the same font or sound right now, so you can kind of pick up a lot of it. But AI is out there just making up anything just to get likes and views, right? So they can make up a fake story about spider bites that give you superpowers and turn you Spider-Man, and they got people flying around, right?
Well, that's when Todd's going to be a millionaire with this little token of human content. Human content idea.
A certification. There must be a certification out there that
to say this
is
not
AI driven. Like, there needs to be a law that says if you develop content it's purely AI, you have to tell the public this is AI, as well as news organizations. I've said this for years. Now I sound like the old guy. I've said this for years.
Back in my day.
Come on, Grandpa.
If CNN or Fox has a commentary show, it needs to say like commentary opinion or editorial opinion, like as a post, instead of calling it news. Because news was Walter Cronkite back in the 70s. And, you know, back when news was black and white, it was news. There was no opinion. We need to educate the public that there's a difference between a talking head, and that's not news from Fox or from CNN or from any of these, you know, The View, for God's sakes. If you're calling it news, or if you're calling it, you know, evidence-based medicine, or if you're calling it content that's AI driven, we have to label that stuff, just like you label a medication and the safety of medication labeling.
Well, I got a question for you, Todd. So let's say this does exist, and there is a label, AI versus human made. Going back to us distrusting, politics and how it's so politicized and left, right, whatever the heck you want to complain about. We won't get into that either. But with a labeling like this, I personally think it's going to be abused by our politicians too, that we don't trust. It's like an AI video could come out to slander someone, but someone in control could be like, nope, this is real, or this isn't AI, when really it's AI. So I don't know. It just goes back to that public trust. And I would like something to be like that, but my tinfoil hat, and I always talk about this, my tinfoil hat just doesn't trust that, something like that too. I want to believe it, but I don't know. I just don't trust our government. I think it's good, regardless of who's in control. It's good to have a healthy distrust, whoever's in power.
Just a little bit, huh?
Just
kind of like bit. Anxiety. You just need a little bit.
Yeah, exactly.
We have the solution. We just have to trust Skynet. Skynet.
They'll make all our choices for us.
Full circle.
Yeah.
It's like not too bad of an idea. No.
Yeah. Tried everything else. Why not? Screw it.
This is awesome. You guys are doing an amazing job once again. Rated RX podcast. You can find them on all of the feeds. And of course, we are excited that you're coming to the Pharmacy Podcast Network. We're going to be distributing, starting with episode 30. And we're going to have a little celebration of the 30th episode of the Rated RX podcast as well. You guys, you got to keep it going. The number one way that a podcast is successful is the consistency. And that's the number one indicator for success in podcasting. So keep going.
Keep going.
Keep on chugging. Yeah. Let's go.
No matter how much you want to cry, keep going.
Yeah, I've cried for 16 years.
We can have an episode where we all just cry,
Don't threaten me with a good time.
We can invite pharmacy students.
Exactly. Shout out to pharmacy students. You guys are crying. You're going to be in $250,000 worth of debt.
Now I'm actually going to cry.
All right. That's it for This Week in Pharmacy. Once again, RX Rated Podcast. Shout out. We'll see you guys soon.
Bye. Thanks for having us.